Hello guys and welcome back to patient positioning. Here we are looking at Trendelenburg position. In Trendelenburg position, we place the head of the bed lower than the feet. The patient's arms should be tucked at sides. This position is used for situations such as hypotension and medical emergencies. The whole essence is to promote venous return to major organs such as the head and heart. So in Trendelenburg's position, guys, you need to place your patient so that the patients lie down on the bed, which will then shift so that the head is lower than the rest of the body. Since your patient ends up nearly upside down, they will need safety restraints, okay? Safety restraints so that they do not fall off the surface. This position should be used in situations where your patients need certain surgical procedures, such as those involving colorectal cancer. In emergency situations, you may find someone having the patients on the ground with a stool, okay, so that you place the foot on the stool, right? Or someone, or the second responder holding the legs up. Yes. So raising the foot off the bed can be helpful if there are problems with certain nerves, okay, such as peroneal nerve, okay. This position also helps promote venous return for patients with hypotension and can help if a patient develops air embolism. Remember, do not use this position with obese patients or with those who have problems with their lung capacity. The RN, you also need to watch for signs of venous pulling around the patient's head, okay? What about reverse Trendelenburg position? This is the reverse Trendelenburg position. You place the patient in the bed, you place the head of the patient higher than the feet, okay? It is the opposite of Trendelenburg position. You can see it. So reverse Trendelenburg is often used for patients with gastrointestinal problems as it will minimize gastroesophageal reflux, okay? Here, the patient is flat, but the table is moved so that the head is higher than the legs. You can be able to see. Similar to the Trendelenburg position, patients will need restraints to keep them off the sliding table, okay? So padded footboards can also be used. This position can be useful for certain surgeries as those involving the head and neck or laparoscopic procedures. As an RN, you need to watch for the signs of DVT and nerve damage in this position. So that's how we place the patient in Trendelenburg position and in reverse Trendelenburg position. Thank you so much.